Did you know that some of the medications you may have in your medicine cabinet could be irreversibly affecting your memory? That's right. What we consider relief today may be silently harming your brain health. And we're not talking about rare cases. This situation affects millions of people around the world, often without them knowing it. So, if you're here, I want to congratulate you. You're taking an important step to protect your well-being and that of your loved ones. Your brain is one of the most complex and valuable organs. It controls your memories, emotions, and decisions. But just like we take care of our heart or our bones, we must prioritize its health. There are factors such as diet and exercise that are well known, but few talk about the impact of certain common medications on our brain function. Today, we are going to break that silence. I am Dr. Garcia, and here at Health Now, my mission is to provide you with clear and practical information to improve your quality of life. On this channel, we explore topics that you don't always hear about in doctor's appointments, but that can make a difference in your health. In this video, we'll identify the 8 medications that scientific research has shown are linked to an increased risk of developing dementia. You'll discover how these medications affect your brain, and most importantly, you'll learn safe alternatives and strategies to minimize your risk. But before you move on, make sure you subscribe to the channel and turn on notifications. Here you will find content designed to empower you, and you won't want to miss any updates. Also, if you have questions or topics of interest, don't hesitate to leave them in the comments. And don't leave before the end, because I'll be sharing key strategies to protect your brain and keep it sharp and healthy. So, now that you know what's at stake, join me. Let's begin this journey to discover how to preserve the most valuable thing you have, your mind. Dementia is not a specific disease, but rather a general term describing a group of symptoms that affect memory, thinking, and social skills, interfering with daily life. Among the most common types is Alzheimer's, which accounts for the majority of cases, but there are others such as vascular dementia or dementia with Lewy bodies. What unites all these conditions is their devastating impact on the brain and on the families surrounding the affected person. Globally, more than 55 million people live with some form of dementia, and nearly 10 million new cases are diagnosed each year. But what is most worrying is not only these alarming figures, but the fact that many of these conditions could be prevented or delayed. This is where the importance of preventive care comes in, and that is why we are talking about medications. How do they influence this panorama? That is what we are going to find out. Understanding dementia means knowing that its origin is multifactorial. Genetics, lifestyle, and environmental factors play an important role. But there is one component that is not translated from Spanish to English. www.onlinedoctranslator.com always considered. The medications we consume every day. Some, even prescribed with the best intentions, can contribute to subtle but cumulative changes in the brain that, over time, increase the risk of cognitive decline. It's crucial that we start paying attention to these silent factors. As you continue with me, think about this. Could there be something in your daily routine, such as a common medication, that is affecting your brain without you even realizing it? In the next segment, we'll discuss a specific, widely used group of medications that could be part of the problem. Don't miss it, because identifying it can be the first step to protecting yourself. Among the drugs that most concern specialists due to their impact on brain health are anticholinergics. This group includes drugs used to treat a variety of conditions such as allergies, depression, bladder problems, and even the common cold. Although they are effective for their primary purposes, they have a potentially dangerous side effect. They block the action of a neurotransmitter called acetylcholine, essential for memory, learning, and other cognitive functions. Some examples of these medications include antihistamines, such as diphenhydramine, tricyclic antidepressants, such as amitriptyline, and urinary incontinence medications, such as oxybutynin. When taken long-term or in high doses, they can impair chemical signals in the brain, leading to a progressive decline in the ability to remember and process information. Recent studies have shown that people who regularly use anticholinergic drugs have a higher risk of developing dementia, especially if they take them for several years. One of the largest studies, published in the journal JAMA Internal Medicine, concluded that the risk of cognitive decline increases significantly with prolonged exposure to these drugs. So what can you do if you are currently taking any of these medications? The first step is consult your doctor. Never stop treatment without professional guidance, but ask about safer alternatives that won't interfere with your cognitive functions. For example, some second-generation antihistamines have less impact on the brain. In the case of bladder medications, there are physical therapies and other drugs that may be less risky. Now that we know the impact of anticholinergics, let's move on to another group of medications that could be affecting your memory without you noticing. Benzodiazepines. Find out why prolonged use can be a risk factor. Benzodiazepines are a group of medications widely prescribed to treat anxiety, insomnia, and other disorders related to the nervous system. Common names include diazepam, lorazepam, and alprazolam, better known by their brand names such as Valium or Xanax. Although they are effective in relieving symptoms in the short term, prolonged use can have worrying consequences for the brain. These substances act by intensifying the activity of gamma-aminobutyric acid, GABA, a neurotransmitter that decreases brain activity, generating sedative and tranquilizing effects. However, this action can also slow down cognitive processes, affecting memory, concentration, and learning. Over time, benzodiazepines can alter the structure and function of the brain, contributing to an increased risk of cognitive decline and even dementia. A study published in the BMJ noted that long-term use of benzodiazepines is associated with a 50% increased risk of developing Alzheimer's. This finding reinforces the importance of considering alternatives when possible, especially in older people or those with a family history of dementia. If you are taking benzodiazepines, it is essential to talk to your doctor to discuss options. There are non-pharmacological treatments for anxiety and insomnia, such as cognitive behavioral therapy, relaxation techniques, and healthy sleep habits, that may offer similar results without compromising your brain health. And speaking of brain risks, in the next chapter, we'll explore a group of drugs you might not have expected: opioid analgesics. Did you know that its use can also affect your memory? I will explain it to you below. Opioids, commonly used to treat moderate to severe pain, have been an effective solution for millions of people suffering from chronic pain. Drugs such as morphine, oxycodone, and fentanyl are among the most well-known of this group. However, these painkillers don't just relieve pain. They can also negatively affect the brain, especially when used for prolonged periods. Opioids work by binding to specific receptors in the brain, blocking pain signals and producing a feeling of calm or euphoria. But this interaction also comes at a cost. Over time, they can alter brain connections, affecting memory, decision-making, and the ability to concentrate. In addition, long-term opioid use can lead to changes in brain structure, particularly in areas related to cognition and emotions. Research has linked chronic opioid use to an increased risk of cognitive decline, and experts warn that these effects could be even more pronounced in older people or those with underlying health conditions. Dependence on these drugs can not only be physical, but could also accelerate the onset of dementia-like symptoms. What can you do if you rely on opioids for pain management? Exploring alternatives is key. Physical therapy, techniques like acupuncture, or even certain non-opioid medications can offer relief without compromising cognitive health. Additionally, working alongside a pain management specialist can be crucial to finding a suitable and safe solution. But not all drugs that affect memory are so obvious. In the next chapter, we'll discuss a category that, for many, is unexpected: statins used to control cholesterol. Find out how they could be related to your brain health. Statins are widely used drugs to lower cholesterol and prevent cardiovascular diseases such as heart attacks and strokes. Names such as atorvastatin, simvastatin, and rosuvastatin are among the most prescribed worldwide. Although their effectiveness in controlling cholesterol is well documented, there is growing debate about their impact on cognitive function. Some studies have reported that some statin users experience memory-related side effects, such as temporary forgetfulness or difficulty concentrating. Although these effects are not common, they have raised concerns, especially among older people who may already be at higher risk of cognitive decline. One hypothesis suggests that statins may interfere with the production of cholesterol in the brain, a substance vital for the formation of neural connections and optimal functioning of brain cells. However, not all research agrees on this point. Other studies have found that, in certain cases, statins may even have a protective effect against dementia by improving vascular health and reducing inflammation. This underlines the importance of a personalized assessment. If you're taking statins, don't stop using them without consulting your doctor. In some cases, the cardiovascular benefits far outweigh any potential memory risks. But if you notice changes in your cognitive ability, talk to your doctor to explore dosage adjustments or alternatives. Now, let's talk about another group of medications with significant risks, especially in older adults. Antipsychotics. In the next chapter, we will explore why its use should be considered with extreme caution. Antipsychotics are medications used to treat serious mental disorders such as schizophrenia or bipolar disorder. However, they are also commonly prescribed to older people with dementia to manage symptoms such as agitation, hallucinations, or aggressive behaviors. Common examples include risperidone, olanzapine, and quetiapine. Although they may offer short-term relief, their use in older adults, especially those with dementia, comes with significant risks. Studies have shown that antipsychotics can increase the risk of stroke, infection, and even mortality in older people with dementia. They can also cause side effects such as excessive sedation, confusion, and an increased likelihood of falls, which worsens cognitive decline. This has led major medical organizations, such as the FDA, to issue warnings about their use in this population. It is important to note that in many cases, antipsychotics are prescribed without first exploring other options. Non-pharmacological therapies, such as environmental modification, behavior management techniques, and psychological support, may be safer and more effective alternatives. If you or a loved one is receiving antipsychotics, be sure to consult with a doctor to assess whether the treatment is really necessary or if there are less risky options. In the next chapter, we'll look at another group of medications that you might not associate with cognitive decline: antidepressants, blood pressure. Stay tuned, because this topic may surprise you too. Blood pressure medications, also known as antihypertensives, are essential for millions of people living with hypertension. These drugs help prevent serious complications such as heart attacks and strokes. However, certain types of antihypertensives have been linked to adverse effects on cognitive health, particularly in older adults. Some of these medications, such as beta blockers, propranolol, metoprolol, and diuretics, can lower blood pressure too much. This can lead to decreased blood flow to the brain, affecting its oxygenation and increasing the risk of cognitive decline over time. In addition, changes in blood pressure can hinder the brain's ability to respond to daily demands, which could contribute to memory and concentration problems. On the other hand, recent research suggests that certain antihypertensives, such as angiotensin-converting enzyme inhibitors, ACE inhibitors, may have a protective effect by reducing inflammation and oxidative stress in the brain. This underlines the importance of choosing the right medication for each person, considering both the cardiovascular benefits and the possible cognitive risks. If you're taking blood pressure medication, it's critical to continue monitoring your levels regularly and talk to your doctor about any side effects. You can also support brain health with habits like a high potassium, low sodium diet, and regular exercise. To close, in the next chapter, we will explore key strategies for protect your brain from these risks and keep it healthy for longer. Now that we've explored the medications that can affect your memory, it's time to focus on what's most important: protecting your brain and keeping it healthy. The good news is that, in addition to reviewing your medications with a healthcare professional, there are many strategies you can implement to reduce risks and boost your cognitive function. 1. Balanced diet. A diet rich in antioxidants can make a big difference. It includes foods like berries, nuts, omega-3 rich fish, like salmon, and green leafy vegetables. These foods help fight inflammation and oxidative damage, two key factors in cognitive decline. 2. Regular physical exercise. Physical activity improves blood flow to the brain, stimulates the growth of new neural connections, and reduces the risk of chronic diseases that affect cognition, such as hypertension and diabetes. 3. Quality sleep. Getting a good night's sleep is essential for memory and learning. During sleep, the brain eliminates accumulated toxins and consolidates memories. Make sure you get between 7 and 9 hours of sleep each night. However, not all research agrees on this point. Other studies have found that, in certain cases, statins may even have a protective effect against dementia by improving vascular health and reducing inflammation. This underlines the importance of a personalized assessment. If you're taking statins, don't stop using them without consulting your doctor. In some cases, the cardiovascular benefits far outweigh any potential memory risks. But if you notice changes in your cognitive ability, talk to your doctor to explore dosage adjustments or alternatives. Now, let's talk about another group of medications with significant risks, especially in older adults. Antipsychotics. In the next chapter, we will explore why its use should be considered with extreme caution. Antipsychotics are medications used to treat serious mental disorders such as schizophrenia or bipolar disorder. 4. Stress management. Chronic stress can damage brain cells and impair memory. Practice relaxation techniques such as meditation, yoga, or simply taking walks outdoors. 5. Mental stimulation. Keep your mind active with activities like reading, learning something new, solving puzzles, or interacting socially. Adopting these habits will not only protect your brain, but will also improve your quality of life. In conclusion, we will summarize the key points and reinforce the importance of making informed decisions to take care of your mental health. Throughout this video, we've discovered how some common medications can have a significant impact on your brain health, increasing your risk of cognitive decline and dementia. We talk about the anticholinergics, the benzodiazepines, the opioids, the statins, the antipsychotics, and the antihypertensives. Each of these drugs, while having a clear medical purpose, can affect memory and cognitive function, especially when used for a long time or without proper supervision. But here's the key. Knowledge is power. Identifying these risks is the first step to making informed decisions. Your brain health is your greatest asset, and while some medications are necessary, it's always important to explore safer alternatives and weigh the benefits against the risks. This doesn't mean abandoning essential treatments, but rather working as a team with your doctors to find personalized solutions. Furthermore, we should not underestimate the power of healthy habits. A diet rich in antioxidants, regular physical exercise, stress management, and quality sleep can be as important as the medications you take. These strategies not only reduce the risk of cognitive decline, but also promote a fuller and more active life. Before I finish, I want to invite you to reflect. Are you taking care of your brain health in the right way? Maybe now is the time to make small changes that could make a big difference in the long term. Remember that it is never too late to start. If this video was helpful to you, please subscribe to the channel and turn on notifications so you don't miss out on more content like this. Also, share this information with your loved ones because what you learn today could protect their health tomorrow. Finally, I encourage you to leave your questions or suggestions in the comments. Is there a topic you'd like us to explore? And don't forget to check out other related videos, such as our guide on foods to strengthen the brain or the video on how to improve your memory in just 7 days. Thank you for joining me today on this journey towards better mental health. See you in the next video.